Awesome. Okay, so I think we will get started. Our live stream just kicked off. So hello, everyone, and welcome. Thank you so much to those of you who are tuning in via our live stream for being with us today. My name is Jacqueline, and I'm the co-director of the Public Health Youth Association. Awesome. Okay, so I think we will get started. Our live stream. And I'm joined by my co-director, Maham, who is an MPH student at NYU. So for those of you who are unfamiliar, the Public Health Youth Association of Canada is a national by youth for youth organization aiming to increase youth education and leadership in the field of public health in Canada.
Today, we are honored to be joined by Candice St-Aubin, the Vice President of Health Promotion and Chronic Disease Prevention Branch at the Public Health Agency of Canada. She has been extremely generous with her time today to answer our questions about public health leadership and public health policy challenges in Canada. So thank you so much, Vice President St-Aubin, for the opportunity to speak with us.
Thanks for having me, everybody. Glad to be here.
Fantastic. So we wanted to start with some public health related leadership questions, if that was okay. So we're just curious, in your opinion, what are the most important skills for public health professionals to have? And do you have any tips for public health students who are hoping to pursue a career with the federal government?
That's a great question, actually. And I'm certainly I'll certainly put my opinion forward, but I think this is really an ongoing conversation. I think that public health, just putting it out there, that public health in Canada it's a changing space, right? We've now witnessed a pretty significant event globally. And so I think how we define and look at public health kind of writ large will also define the types of skills that I think will go a long way. One thing to say, though, I think is that curiosity that feeds, right? Asking those questions, knowing that a solid evidence base and science to inform certainly decision makers, but also the type of interventions that we make either at the federal government level or within provincial territorial jurisdictions. I think that is also a critical component. Just from my experience, so my experience has been within the public health sector, but also just across the social determinants, right? So I've worked on the justice side. I'm an Indigenous person, so a lot of Indigenous issues and has been a part of my background. But I have to say, really going in with an open mind and a desire to ask questions. And not to be afraid to ask those difficult questions and to be innovative in how you look at the evidence, to try and not always follow. Just because we've always done public health this way doesn't mean that's necessarily going to be that way that we do it in the next, certainly when you guys are graduating and entering this into, certainly in the federal system, we are looking for those innovators. We are looking for those people with a thirst to try things differently. Obviously, again, with the underpinning of science and evidence and to inform that work.
Thank you. And I think what you're saying about the pandemic and kind of carving your own path, like the pandemic has kind of forced us all to think of our careers and how we want to move forward in a different way. And for our next question related to the pandemic is, what do you envision for the future of public health post-COVID-19?
So this is where I'm really, really engaged on. So the work that I do, again, is on kind of the upstream health promotion work, but also looking at the longer term impacts of the pandemic. So while the pandemic may ostensibly come to an end, I think the implications and effects will be, certainly within a population health, will be there for the next while. The priority, though, for certainly for the agency and the government of Canada, and note with myself as well, is around health equity. The pandemic has really shone a light on things that we knew to a certain degree, just as a general Canadian population, that there are vulnerable populations that are far more impacted regardless of pandemic. But what the pandemic has done is shone a light on health equity. So I'm talking, sex and gender, LGBTQ, Indigenous, all of these cross sections, socioeconomic status. So it's really, how do we ensure that we have that health equity lens on all of our work going forward, regardless if it's on border control or if it's on, maternal child health investments. Mental health is a big one, health and wellness overall. So I think for us, health equity is a really large space that we need to start occupying and really kind of lifting up to the top.
Fantastic. I think we have a question from Sabrina next.
Hello, Vice President St-Aubin. My name is Sabrina, and I'm a Bachelor of Science student at Wilfrid Laurier University. So my question to you is, many Canadians are experiencing long-term COVID-19 symptoms after infection, and at present, there are only 6 post-COVID-19 clinics in the country. So what is being done to support Canadians experiencing long COVID?
Great question, Sabrina, very timely. And please call me Candice. I'm not vice president anything. So, that's a really timely question. That is certainly something that we are monitoring it, and it's happening globally. There was a study that was put out by the United Kingdom, I want to say in October 2020, that was starting to kind of unpack what these implications are. We've come a long way through multiple waves at this point. So really we're just really trying to monitor those trends, emerging, current, and pulling together and working with external stakeholders and external partners, the scientific community, right? Academic scientific community, but also internally working with CIHR, the Canadian Health. Oh my gosh, I'm drawing a blank. This is acronyms when you work in the government. CIHR, the research.
Canadian Institute
on Health Research. I was going to get it. So working with that, Statistics Canada, as I said, we're really trying to gather that evidence base, right? So yes, there are those sites available, but at that point, we're still just trying to paint the picture and really look at what those trends are. There was some work being done. I know within our area, we do have surveillance and epidemiologists that are looking more around the impacts, let's say on maternal child health or a pregnancy during COVID. What does that, if you have COVID, if you contract COVID while you're pregnant, what does that look like, over the longer term? So yeah, we are really investing in that research that's much needed, the evidence that's needed to show, so we can really intervene and support at the right level and in a way that really kind of addresses this unknown really at this point.
Hello, Candice. My name is Jazz Taiwana. I'm a recent public health graduate from Simon Fraser University, and I'm currently doing some research with the University of British Columbia on public health. My question is regarding vaccine hesitancy and misinformation. So how can we as public health professionals, but also as the Public Health Association of Canada, what is being done to combat misinformation and vaccine hesitancy when we've been seeing it's on the uprise?
Such a great question, Jess. And, I have to say that the association, the Public Health Youth Association right now, you guys are uniquely placed, right? You have an audience in a way that you can connect with, like through a social media base or other ways that probably are not traditional ways, like, when we think about public service and this, big institution, you're able to mobilize differently, which I think is fantastic. Some of the biggest things, though, I think that we're trying to push is really ensuring that you're using accurate information and that you're promoting accurate information, but you're promoting it in a way that makes sense. And I go back to kind of that health equity piece, that in a way that resonates, right? So we've heard from behavioral scientists that changing the narrative around vaccine misinformation or disinformation really has greater traction when it comes from the communities themselves. So it's a language that is culturally relevant or relevant to that geographical space and place in which they're at. So I know from our lens, one of the work that we're doing just at the agency in my branch is we have this vaccine challenge right now, innovative challenge. It's open till Thursday. It's on the agency's website, where we're trying to mobilize at the community level, working with experts too, but really those information activities and campaigns, and use a campaign, but that's not really the right term, but it's really that community appropriate and culturally appropriate information. So I think, again, we talk about youth populations, be across Canada, that this is the type of thing that I think we need to work more on, is the language at the people, from the people, for the people.
Thank you for that, Vice President St-Aubin, or Candice, if you insist. So I just want to say it's an honor to be speaking with you right now. And just a little bit about me. I am a Master's of Public Health graduate from the University of Toronto, and I am currently a research coordinator at the Joaquin S. Bryce Institute for Indigenous Health. I see you smiling, so I feel like you might know what I'm talking about. But I do have a couple of questions regarding the government's partnerships and engagement with Indigenous communities. So this is kind of a two-part question, so take it as you will. But the first question I have is, what input have Indigenous people had on policymaking at the federal level? And the follow-up question to that is, why is it often with only the Assembly of First Nations and not directly with individuals or communities?
So I must admit, Sharon, when I saw this question, I was like, yay! So my whole background predominantly in the public service, but also prior, was with working in Indigenous communities and with partners, being, a First Nations descent myself. It was something quite of a passion. I will say, when there was the introduction of the reconciliation efforts brought in by the current government, we did see a fundamental shift on how we do policy in the within partnerships, right? There was always this predisposition, if you will, to work with the big three, as they call them. So the Assembly of First Nations, Inuit, Kanatami, and then Métis National Council. My experience, I've been very blessed that when it comes to policy development, we were challenged by certainly the political will to co-develop. So a big term, a buzzword, if you will, within the public service is co-development, where we physically write, like literally hand over the pen to our partners, First Nations, Inuit, Métis, and work in a way that is, again, it goes back to the language of the people, for the people, by the people. So this is some of the things that are happening. And I've had the privilege and honor of working on several programs and policy changes, both in skills and employment, as well as education and devolution of education into the hands of First Nations community leadership, particularly on reserve, because that's where our federal jurisdiction is. So it is a significant change, unfortunately, because, of the nature of the public service, we are bound by certain requirements around cabinet confidence and how we work with parliamentarians and how we work within the structures for approval of policy. So there is a change. Going to your second part of the question, working with just the Assembly of First Nations, there's a role, certainly a place for that partnership. That totally understand. It's hard to speak with, over 900 First Nations communities. That said, something that I constantly challenge and push, and certainly I've seen adopted, is going to the communities themselves. So it's working with regional organizations, it's working with community-driven organizations, not necessarily a political level, but the community voices, very different perspectives. But there is a role for leadership. And we do see, like in the West, where we're dealing with treaty chiefs about treaty issues, I don't go to the Assembly of First Nations necessarily to speak to them. I will deal with treaty chiefs in Alberta, so it's really, nuancing and knowing when you need to have just a national perspective, certainly more at the political level, to be honest. But if I'm doing programming or policy development, I am going to reach out to those more regional-based organizations and community-based organizations, because I think that's where the real, nitty-gritty gets down to it. So that's what I like to talk about. Great question.
No, thank you for that. But that brings me actually into my next question, because I was really fortunate where I got to take part in part of the PHAC companion report on Indigenous peoples and COVID-19. So this was published, I think, about 2 months ago. I'm not sure if you read it yet, but then it was also directly engaging with community members and organizations. So I guess for some context, one of the findings was that First Nations and Inuit community members living in northern regions experienced geographical as well as financial barriers to accessing specialized care. So I guess the question from here is that, do you know if there are going to be any plans at the federal level to improve access to, as well as increase Indigenous control in healthcare for northern communities? And I think the other question is that, will it be possible for those communities to stay within or even near those communities when they're accessing care?
Mm-hmm. See, this is what I'm talking about, these intense, multi-level questions. That's like a whole doctorate thesis right there, just saying. So yes, more or less, basically, yes. So we're always looking and trying to work with partners on a way to increase access to services. Certainly, be it public health services, health, the more traditional health services, or any services they're on too, right? Social services, et cetera. And again, it's not, we're not there yet. We still need to have conversations. There have been investments in infrastructure. There have been investments, certainly at a capacity building level. Again, it really comes down to, especially the North, it's expensive. It's expensive up there, and it's, infrastructure challenges, IT challenges. So all of these multi-level factors have to be dealt with. And again, the pandemic really, again, brought this to light, right? At least it brought it to the spotlight, because we always knew it was there. We've always been talking about it. When it comes to control and authority over health, I encourage you to, if you can, reach into and look to and Google and search and find out about the work that Indigenous Services Canada is doing around the health legislation. We had a terrible incident in Quebec in Joliet with a First Nations woman. And I'm sure you probably have heard of it and aware, and that really brought the systemic racism that is inherent in health services, as other services. We talk about, policing and what have you, and missing and murdered Indigenous women and girls. But I think that demonstrates a commitment, certainly on the part of the federal government. Having been at ISC for a while, I was really happy to see the hard work and heavy lifting on trying to do legislative change to really push the need for an Indigenous specific health legislation or perspective. So again, happy to share, sending out links if you want, and connecting you with folks over at Indigenous Services Canada and First Nations Inuit Health Branch. I think we see some really good gains, and they also have a public health lens within that work. So.
Hi, Candice. My name is Navni, and I'm a recent graduate from the health science faculty from Simon Fraser University. And my question for you is, what is the Public Health Agency of Canada doing to ensure that public health is made a priority on the federal government of Canada agenda for future public health emergencies? And is there any team or specific priorities that are being shifted to understand how Canada can be better prepared for future global health emergencies such as this pandemic?
Mm-hmm. That's a great question, Natalie. Mm-hmm. I'll do my best to provide a satisfactory answer. But yeah, so, it's kind of like a double-edged, like two sides of a coin or a double-edged sword. So the public agency has really kind of flown under the map a little bit, right? Like we weren't Health Canada and we weren't, the big players until the pandemic hit, which really was an eye-opening experience to the need to continue, like the need to build and certainly increase our bench strength with regards to public health. So this is why the fact that I see, such interested, young, brilliant minds who want to engage in public health, I think is really exciting, because we do now all of a sudden see this push towards us, not just, standard medical health, but also the need for solid public health minds. So that is something we're really looking towards within the agency. And I can't speak too much about the kind of like what are we doing internally, because that's a whole other group, but always happy to come back and delve on this a little bit more. But it certainly is really ensuring that we have a strong scientific family within the public health agency, and not just public servants, if you will, which I am one of them as well, but certainly that strong scientific and medical capacity within the agency. We are a priority right now. And as as Sabrina was asking about the long-term impacts of the pandemic, I think it will keep us pretty high up there for a while. One of the other files I know within my bailiwick outside of the pandemic are things like the opioid crisis. We had a crisis before COVID-19. We had the opioids crisis. So that is, again, something that my team are, we're working on. There's surveillance efforts. There's certainly just substance use writ large. But again, we can't turn our minds away or our efforts. We had to continue pushing that track along. The pandemic has really compounded the issues around opioids, right? So we know that, again, a new normal, whatever that should look like, we still have all of these other issues that need to be, efforts need to be put into it, being opioids, mental health, and wellness. Post-traumatic stress disorder was another one of those really big files, and of course cancer screenings, etc. These are issues that have also been compounded by a pandemic, right? Cancer screening. What does this look like? How will this impact Canadian population health and public health in the next 2 years, let's say, as we continue with these waves? So it's a really multifaceted question, Navneet, and I probably did a terrible job at answering it. But just so I see public health really, we're in it for the long haul, and it's really ensuring that we have a strong, like I say, that strong evidence and that strong family in the agency to support and guide individuals like myself who are maybe more policy leaders or program leaders. But again, critical that it's based on scientific evidence.
Thank you. That was actually very informative.
Yes.
So I'm back with another question, and I do want to thank you. All the answers you're giving are really informative, as Navneet has said, but also just super inspiring as well for us as future public health professionals or current ones. So my last question is actually regarding housing, and my exact question is, how long and what will it take to provide adequate as well as safe housing on and off reserve? So it potentially might be a multifaceted answer as well, but I'm excited.
Huge share. It's like, oh my goodness, yes. I'm on the hot seat. Oh, that's a great question. I saw that too. Because Jennifer had let me know that these could be some of the questions. I was like, oh, that's a big one. It is a big one, to be honest. I can't speak to a date, an end date. I mean, we know the complexities of infrastructure, certainly in rural, remote, reserve communities. We know either housing infrastructure, water infrastructure, but I can say, and I think it's been evidenced certainly by the efforts over the last couple of years, that there is investments in infrastructure, including housing. CMHC is involved again with colleagues at Indigenous Services Canada, as they hold the lead certainly on reserve. In more rural and remote communities, if it's not a reserve, it's a little bit challenging because of the interjurisdictional nature of how we work with provinces and territories. So when we think about, certainly Métis, I'm assuming it's an Indigenous focused question, but any rural and remote communities always have challenges around infrastructure, right? Housing included. So it's really how we work with provinces and territories and how we can support investments, certainly at the provincial territorial level, into ensuring safe housing. It is much like the water, an ongoing conversation with leadership on reserve, First Nations leadership specifically. And I know that there are significant investments that have been made, because certainly over the past couple of budget cycles, and will continue to be made. It is one of the priorities of Indigenous services. This is why I encourage you guys, it would be neat for you guys to have a conversation with them as well, because they do have, it's a social determinant of health, right, is housing. We have homelessness strategies, and we have, again, compounded by the pandemic. And I think, who was it, Sabrina? No, wait. Jazz, somebody talked about the link with geographical challenges. No, actually it was Sharon, it was you. Access to services in northern communities, right? So we see there has been some trends about the rate of transmission in more remote communities, but again, because of housing challenges, where they're multi-generational families in the small dwelling tends to, encourage transmission rates, if you will. And again, that is a non-scientific answer, but I just, that is some of the things that we are seeing, the impact of housing certainly on pandemic or any communicable disease for that matter. Thank you for that.
Hi, Candice. Mubin here. My name is Mubin, and I am a student, a Master's of Health Informatics student from the University of Toronto. And so the lens that I come from is more health and technology, the buzzword digital health. And I wanted to ask you a question on kind of the collection of data. So what recommendations are being put forth by the Public Health Agency of Canada when it comes to race-based data collection and incorporating participatory action efforts in presenting diverse data sets in academia and government data collection? Because now with the integration of digital health, there's a lot of communities that are being impacted who perhaps don't have internet access, who can't use telemedicine. So from that angle, how are these data sets being collected and being used for health promotional purposes?
So that's a great question. Well, it's informatics, I went, no, but in all honesty, you can tell I'm a little bit of a joker, but data is such a critical and vital component right now. It is a priority. The bulk of my conversations that I have and meetings that I have throughout the course of a week is all around data. How do we access data? How do we disaggregate data? Where do we access data? Who owns the data? How do we protect data? The privacy issues around data. So it's, as you can tell, obviously you're probably, you know, you're an informatics person, you know that it is very complex, because again, there are, you know, when it comes to accessing data, and I think about more of maybe, you know, from Indigenous perspective, again, having my background is, there's some sensitivities around the use of data. Why are you collecting data? How will it be used? We saw it with even the COVID app. People were reticent to sign up for it as a tracking mechanism and stuff. So there is, again, a lot of this, you know, I don't want to say misinformation or disinformation or information or perspectives that are based on other issues, like other life contexts. What I will say is that there is concerted effort do we have data gaps? And again, part of the data gaps is some of the data that we're gathering, and I think about the pandemic, comes from provincial systems and territorial systems. And so it's trying to also have a sharing relationship with the federal data systems and the provincial. That has become one of our challenges. And certainly, perhaps the level of data that they can collect may not meet the needs. Like, we're looking for things like disaggregated data. They may not collect it, you know, either through capacity challenges of themselves, like we're a much larger machine than the provincial and territorial governments. But also some of the data sets that we do tap into are like things like highs or hospitalization and stuff. So again, it may not be as disaggregated as we need it. So we do have questions that, again, we're looking internally and with external experts as well on how do we access a more rich bounty of data. That said, I do also think that we're also looking at what other data sources are we collecting from that we just don't tap into, because we're collecting data through other mechanisms that we just haven't connected all the dots. So there is a concerted effort in turning to look at the data sources that we are collecting that we can maybe better mine to get more information. And I think about, you know, even EI data and how in SIN level data and it impacts on economics, the economic impacts of the pandemic. Like, we could look at linkages there. And then again, how do we have better relationships with provincial and territorial systems so that our systems talk at the same level that we need them to talk to? And then what are new potential data sources we haven't even considered yet? Does that answer it at all? Did I sound like I know informatics?
Absolutely, thank you.
Awesome. Thank you.
So we have one question from our audience. And just to note again, my name is Maham. So our audience question is, you noted that we are seeing the opioid crisis worsen during the COVID-19 pandemic. What is happening at the federal level to address this and put a stop to preventable deaths?
Mm-hmm. That's a great question, and thank you for that. So again, we are obviously increasing surveillance, right, to try and disaggregate the data on where do we see it happening, where's the prevalence of increase, what are the, you know, the population sections that we see more increase. We've seen the situation out in British Columbia. We're trying to work closely with provinces and territories for solutions at the local level, while we provide more of the evidence base and research on opioids. So we work at the Public Health Agency, we work across the health portfolio. So we work with CIHR on the research components, but we also work with Health Canada, and they have much more of the regulatory labeling bodies and stuff. So we're trying to look at a really multifaceted set of interventions. So it's, you know, health promotion to promote healthy activities, and then prevention through risk behaviors. So based on evidence and disaggregated data, et cetera, working with provinces and territories and what they're seeing at their level, at their jurisdiction, we're trying to figure out and identify ways that we can intervene to support the promotion of positive activities and reduce those risky behaviors. So it's not an easy, you know, solution. It's not just a one size fits all. It really has to be space-based, place-based in a way that makes sense to the community, be it that, because it's happening across all levels of Canada, all socio-demographics. So we need to kind of really see how over the coming months, as we come out of the more crisis lenses of the pandemic, how it's really impacting the crisis.
Fantastic. Thank you so much. I just want to be mindful of your time. I know you've answered so many of our questions, so thank you. We are so appreciative. That was so informative and inspiring. And I just wanted to give you the opportunity if you had any last words of advice for the future generations of public health.
Just thanks so much for making time for me. I just, before I go, I just have to do a land acknowledgement because I didn't do it in the beginning. So I'm coming from the unceded traditional territory of the Algonquin-Anishinaabeg people, my people. But I just want to put that out there. Parting words of advice, I just think keep the energy up and be innovative. And I think about the public sector. We need this. We need the innovation, the energy that I really think that, cohorts such as yourself coming through the system and having witnessed this, unprecedented, as we always hear, the unprecedented event. I think you need to harness this. This is an opportunity to really push the boundaries a bit and challenge a little bit of the status quo. And, I get to spend some time listening to Teresa Tam, who's brilliant and lovely, but she's doing everything all the time. But she's really open too. Like it's the innovation we want to see. How do we do public health different? Do we need to do it different? What does that look like? I don't know.
Thank you so much. That was fantastic. We really appreciate your time again. And this recording will be available on our YouTube for those who would like to watch it back. So thank you so much, Candice.
Miigwech, everybody, and thank you, and be safe. Wash your hands and social distance, wear a mask.